On this episode of the podcast, I have with me Urvish Parikh. He is the co-founder and CTO of Nirvana. We're going to be talking about leveraging machine learning in healthcare insurance. And we're going to be talking a lot about existing standards, the way things are done. How do you fit into that ecosystem? Because it is a very deep, big, wide ecosystem that is not easy to change. We're going to talk to Urvish about how he manages that and how he focuses on adoption and some of those challenges. Urvish, thanks for being on the show. Appreciate it.
Thanks for having me.
All right. Before we start, could you tell everyone what you guys do at Nirvana?
So Nirvana, we're a B2B company whose sole directive is to make healthcare more accessible to patients by making cost of care a known quantity. You can go to a coffee shop and you know how much your coffee is going to cost you. But if you go to a therapist, you don't know how much it's going to cost you until you get the bill. And so in America, we have this huge surprise bill and medical debt issue. And a lot of that comes from just not knowing how much things are going to cost us. And so we've built up some AI and some biller tools and integrated with EHR systems to make sure that all of those transactions go through our system and we increase the cost transparency as it goes through our system and make transactions much more simpler in the healthcare ecosystem.
I just recorded an episode with somebody talking about the pricing model within value-based care. And it's really interesting because I think a lot of people are approaching the issue of healthcare, insurance, some combination of it in different ways. I guess when you look at the challenge, you said obviously the transparency is an issue. I think anybody who's gone to the doctor, had a procedure done, you're always kind of guessing, ballparking what things are going to cost. When you're looking at that, what are a couple of the fundamental obstacles you see from a technologist viewpoint of why so far we haven't had the transparency? Or maybe it's just because, and maybe the question, the other side of the question, if that's easier to answer, is why do we not have transparency?
It's a really great question, and I think that's been the core investigation for Nirvana. And when we first started working on this problem, we tried to approach it from a really broad spectrum solution. Like, okay, well, is it at the eligibility check? Is it at claims filing? Is it at making sure that patients get paid and reimbursed? And we identified actually healthcare transactions sit on top of a old 1980s standard. And if you think about it, healthcare has changed so much since 1980. There's new schemes. There are different specialties. There's different ways of delivering care as well as insurance. And when you have a dynamical system that is constantly adjusting to the market, right? Like insurance companies are adjusting to their budgets, or they're adjusting to demographics, or there's constant shift that is all being constrained by a really old and brittle standard. What you're going to end up getting is a lot of information being sort of scattered in that standard. And so what we did was okay, well, we have this standard. It's a double-edged sword, right? It's great, standard already exists. That means that, existing EHRs are using it. Clearinghouses are using it. There's a bunch of integrations already there. How do we recompose the information that's been lost in the standard by using AI? And so what we ended up doing is we'll build these machine learning models that are trying to identify, well, how does Aetna talk about complex benefits? How does Cigna or BCBS talk about a new specialty like weight management? How does it communicate? And when the standard is not able to contain this information, they all figure out different ways of talking about it. And so this machine learning model, all it does is Aetna likes to talk about complex benefits by putting it in this place, or BCBS puts it in another place. And so it's this layer that sits on top of an existing standard that's just making that standard a little bit more coherent for other consumers to use downstream.
Something you mentioned 1980 standard, and obviously you mentioned a lot of things have gotten modernized, right? So my medical insurance has gotten better with communication, right? So I see information more accessible. I'm not sure it's always easy to understand, right? So I think even as we're kind of seeing some of that evolution, some of it is still mired in things that, a normal person has to spend an extensive amount of time on. When you're looking at that 1980 standard and you're looking at what you guys are trying to do, how do you actually work? I mean, as a company, machine learning trying to be applied to the solution, how do you work with a standard that's very old, legacy oriented, deeply entrenched within an industry? I mean, are there challenges with that, or is it actually help because a lot of things are defined and that just might be old?
To be honest, this standard is built just for healthcare transactions. So breaking into understanding the standard is difficult. It's not XML, it's not JSON, it's this weird string-based standard. And the second thing is, the unpacking that standard, you're right. What you've said is true. It's like, yes, insurance by itself as an industry has gotten more complex, right? And, now there's these new schemes. Oh, you might have 10 free sessions before your first visit for PT or something like that. That's new. And that's going to happen as an ecosystem evolves, right? It's going to try to find a new way of constraining, it's a constraint satisfaction problem, right? There's a bunch of constraints that they're sort of adjusting to, and they're going to try a little, maybe session limits, maybe they're going to try complex benefits. They're going to try a bunch of things because they also have to compete with each other, right? So Aetna has to compete with BCBS for Microsoft's business. And both of those companies are constrained by the same thing. And when you have the same constraints pressuring a market dynamic, the nuances become much more complex. And so what you're saying is true. And so what we're doing at Nirvana is like, yes, this is going to happen. There's going to be more and more complexities in the ecosystem. We've integrated a standard that makes the complexity a little bit more easier to parse, but how do we operationalize that? So we've actually built out a full stack application that our billing teams for digital health companies use. So it doesn't matter that you have 10 free sessions, that responsibility of what to do with that, it shouldn't be your responsibility. It should be the digital health company billers or the practice billers that are teasing apart how to operationalize your eligibility check. You should just be able to show up. Nirvana handles how to parse your eligibility information. We pass it on to the billers so they can actually operationalize it and see you, right? So that the complexity itself is managed by our own application that we sell as well.
And I don't know if you know the answer to this question, but I was just kind of curious. Is this a U.S. American-based problem? Do other countries? I'm very unfamiliar, but I just was kind of curious. Is this seen other places, or is it a creation of our own here in this country? It's
uniquely a U.S. thing. It's sort of our responsibility as citizens, as beneficiaries to an existing system to tend to it, right? And this is our way of tending to the system that has supported us for so many years and will support us even after we pass. And so this is Nirvana was created from this social responsibility. It's like, hey, look, this thing is not going anywhere. Maybe one day we'll have Medicare for all and we will celebrate that. But in the meantime, there are all of these, this rate of transaction is so slow that it's created these cesspools of competing incentives. And what if we increase the transparency, speed up the rate of transaction so that there's less time wasted in the process, that Amir can actually get his reimbursement faster. And if we get to do that, then we are actually tending to the system. Right? That was our frame when we started this thing. It's like, okay, it's a social responsibility for us to actually tend to the system that will outlast all of us.
I guess just a question that comes to mind. I'm listening to the value add that you guys are creating. You guys are in a very noble mission, old standards, legacy companies, legacy infrastructure. Why don't they do this themselves? What's keeping them, out of curiosity, doing the machine learning, putting it off? They own the data, they own the codes, they own the part that they are managing for their subscribers. Why don't they do this?
It's a really great question. And I've asked that question many times. My hunch is that it's a competing incentive, right? Insurance companies are incentivized to make sure you have transparency. If you don't know what you're going to pay, then you're less likely to go seek care. And it's this shock, right? It's like, if I'm thinking about going to seek therapy, and I don't know how much things are going to cost. And, middle class is huge. American middle class is huge. It's really hard to budget for something you don't know the cost of. And so my hunch, it's actually a competing incentive. And the other part is, look, these companies are really old. They're really old. And if you really look at it, there's so much waste that happens in these companies. And think about medical debt. Payers don't want medical debt because at the end of the day, they're going to have to resell that debt for pennies on the dollar and send someone over. Maybe they'll receive it, maybe they won't. And legislation is changing, right? Like under $500 for medical debt, it's not going to go on credit report. That might change, right? It's like, it's not incentive. It doesn't make sense for payers to go for medical debt. So part of it is competing incentives from like cost of care perspective, and the part of it is just inefficiency in the system. And they're all bound to adhere to the standard, right? So these payers are bound to adhere to the standard. To be honest, a lot of times the information is there. They just don't know how to transmit it. And insurance companies have large call centers. And think about the cost of that call center. For insurance companies to pay for that call center, and then our patient or our practice billers to call that call center to get the information that's already into their database, that is a costly procedure for both parties. I don't think anybody wants that. And I think what's really going on is just inefficiencies. You don't know how to do it.
So something that's been very interesting that I've taken a look at is companies that are legacy that don't have capabilities, but do have lots of data, and they don't have these solutions. And in this case, they actually might be a competing solution and might not want to present it. And we have companies that are startups that have those capabilities and obviously are tapping into existing standards, existing data, and trying to add value on top of an industry. When it comes to adoption, obviously companies are used to working within the frameworks they've worked in the last 20, 30 years. What are the challenges that you see for adoption within the actual practitioner's office?
Yeah, that's a good point. I think, so I'll sort of give you an example of a competing company that sort of highlights what you're saying. We integrate with clearinghouses, and clearinghouses integrate with payers, insurance companies. So they manage the connections, the Aetna, BCBS, Cigna, all of them, right? So their objective is to maintain connections. And they do that by integrating with the standard that I mentioned, right? The 19 standard. So they Like all of these insurance companies use that standard. They ingest all of it, standardize it in their own JSON or whatever it is. So their objective is just connection, right? We sit on top. We say, okay, yes, so you're right that the clearinghouse has all of this data. We're at a fraction of the data that they have. But what we've done is said, okay, you're sitting here, you have all this data, but do you have data that is operationalizable? Do you have data that the practices can use? And a lot of times the answer is no, because they're not talking to the customers directly. They're not specialty specific. They're not saying, hey, this data kind of breaks down between mental health and physical therapy. And we're trying to bucket it all together as if it's the same thing. But if you look at the operations and the workflows for a PT physical therapy practice versus a mental health practice, you'll see differences. And so we said, look, we're going to try to really specialize for specialties. We're trying to specialize for physical therapy or mental health so that the data that these clearinghouses give us, that we get a fraction of essentially, is actually usable. And making it usable is what gives us the engine, right? This is how we collect this, making it usable, having users actually start to work with it, add to it. We have our own full stack application where people can actually interact with this data. That's what makes our machine learning models work. We have these feedback loops. But so if you don't build feedback loops in your data store, then it's basically stale, right? So all of these companies that you're talking about that have all this data with no feedback loops. And so we said, we'll bring it to the customer so that we can build feedback loops and tune to the specialty instead of just collecting data and then figuring it out.
Interesting. So yeah, as you're speaking about this, in the way you guys have approached it with the focus on the specialization to really focus on the workflow, I started thinking about change management, and I might be wrong, but it's almost as though you thought through the change management first before tackling the problem, because that adoption piece typically is missing that component of change management. And the more of the, in your case, ML, but more of the AI, Gen AI solutions that are coming to market, I think they're going to have to solve that change management piece before even thinking about the solution, because the way we impact people, quote unquote, the human in the loop, however way you guys want to phrase it for what you're doing, I think that's critical. And I think that's, to your point, data, bigger companies with that data might not have the ability to be that detailed. So I think amazing example. And I guess maybe, I wanted to take the conversation down one more, path before our time finishes. Within the actual product, and I don't always ask technical questions, I try to keep it high level, but I actually want in this case kind of maybe let the audience peek into some of the complexities when it comes to machine learning that you're seeing. Obviously, you're dealing with very old standards. It's an industry that's been around, you mentioned, has way too many roots, and that you need to attack this problem in a different way, leveraging machine learning. Maybe talk to us a little bit about how you work with existing standards and where the machine learning fits in within that construct.
So if you think about it, the current 1980s standard that healthcare transacts with is kind of like, imagine if Apple never made any innovation and stayed with Thunderbolt from 1980. It's a really old standard. It's a moat, right? It is a moat because it's really hard to integrate. So what we've done is that, okay, let's try to make this standard a little bit more accessible, right? So what we've done is taken this standard and put some machine learning behind it and make it a little bit easier to transact with. And it's a REST API. It's very easy. It's like the USB-C of the digital health transaction system. And our our thesis is, look, we're not going to try to create a moat. And anyone can use REST APIs. Our way of staying ahead is to make sure that our innovation flywheel is in effect, that we're constantly making healthcare more accessible and easier to transact with by increasing cost transparency. And as we've seen, this problem's not going to go away as long as there's innovation going on in healthcare. And so we just got to be ahead of the game. And that's our process.
Interesting. I actually thought that was a really great analogy, because as you were talking, I was kind of all kind of clicking and making sense in terms of the approach and everything we talked about. And obviously a fascinating industry. I don't think 30 minutes does it justice. I'm sure we could probably do 30 minutes and we still probably would be scratching the surface on this. But I know you got to get back to it, Urvish. If somebody does want to reach out to you to kind of follow up and ask you a question, or just anything regarding what you've mentioned, is there a good way of touching base with you?
You can find us on LinkedIn. You can find me on LinkedIn.
Okay. All right. So we'll make sure to include that in the show notes. Thanks again for being on. I really appreciate it. Thank you for the conversation.
Thanks, Amir. Really great being on this show.
Absolutely. Thank you. All right. That's it for this episode. We'll be back again, different guests, different topic. Until then, two things. One, I think everything Urvish talked about was absolutely where we are at within modern machine learning, AI, Gen AI solutions. And I actually really liked how he talked about focusing on that adoption piece, really specializing what they're doing to fit a specific workflow to make sure people are using it. I think that's something that is not talked about enough. And I thought that was really interesting, especially in an industry where there is such a deep entrenched, industry with roots and standards that you got to deal with. I think he did a great job explaining that. Please share this with somebody else that might find the episode interesting. I really would appreciate that. Also, like, subscribe, comment, leave me a review. Let me know how the podcast is going for you. I'd love to hear from you. Until next time, thank you and goodbye.